All right, we're all set.
All right, thanks, Nicole, and welcome everyone. For those who I have not yet met, my name is Lara Parilla. I'm the chair of this advisory board, and this is the Health Planning Council monthly meeting. Thank you for being here today. We are going to start with approving meeting minutes from which months is it? Sorry, Nicole.
January and November.
January and November. Thank you. So first question is, does anybody have any changes to the January or November minutes? Okay, can I have a motion to approve the minutes?
I'll make a motion to approve.
This is Sue Ellen. I'll second.
Thank you, Beth. Thank you, Sue Ellen. So now we'll have a vote. All in favor of approving the minutes? Any oppositions? Any abstentions? All right, minutes approved. All right, so we have a great agenda today with two special guests with us presenting from Care Compass. And I have some bios to introduce Dawn and Nicole. So I'll start with Dawn. Dawn joined Care Compass Network in August 2015, bringing along with her over 16 years of project management experience in the electronics industry. Over the past 10 years, Dawn has led a project management team working on DSRIP projects, cohort management program, grant-funded initiatives, and the Social Impact Pilot Program, or SIP, across the 9-county region. Dawn has led the Social Care Network for Care Compass since October 2024 and continues to support initiatives focused on integrating social and clinical care in the community. And then we also have Nicole with us. Nicole Cashman has over 20 years experience in the nonprofit sector and a solid background in program operations, strategic planning, and financial management. Prior to joining Care Compass in December 2024, Nicole worked for Opportunities for Otsego, which is located in Oneonta. And there she led a team of 85 employees providing oversight of the operation of 9 Head Start centers and home visiting services to more than 300 families in Otsego County. Nicole was also the director of community homes at Springbrook, at the time spanning 5 counties in the Southern Tier, where she provided leadership, metrics analysis, implementation of reporting systems, and collaboration with community partners and certifying agencies. So with that, I think I am turning the presentation over to Dawn and Nicole.
Thank you for being with us. Thank you, Laura, for the introductions, and thank you all for inviting us to present and share with you today updates on the Social Care Network. So my goals for the presentation today is, for those of you that are not already familiar with the Social Care Network and the services, to give you some background on what that is, and so that we can level set the amount of information before we get into some of the data components. We'll share some data on how it's going with the services to date, how specific data to Tompkins County specifically, so focus on your area. And also talking about some of the challenges that we're seeing that you may be able to provide support with, and also sustainability of this program. And then later on, as part of the presentation, I'll share some of Care Compass Network's overall initiatives outside of the Social Care Network and how you might be able to engage in some of those. I'm the type of person that I love questions, so please don't be shy. Ask them at any point along the way. There's not really a perfect time for that. So let's, as I'm on a slide. If you have a question at that point, please don't be shy in asking, raise your hand or jump in, depending on how this is operated in the past, but please, that's what I'm here for. So I encourage questions. I'm going to go ahead and share screen. Making sure I do the right one here. Hang on a second. This is what I want. Okay. Okay, looks like I'm sharing my slide deck and you guys can see that. Perfect. Let me just move some screens around here so my screens with all of you will be to my right. So if I'm checking back and forth, it's because I'm trying to make sure that I'm not missing hands raised or things like that. So I do see some familiar faces. I know some of you, I've worked with several of you, but many of you are new to me. So nice to meet you virtually. Again, don't be shy, jump right in as you have questions. So let me do presentation mode and we'll jump right in. Okay. So one of the things New York State has recognized over the past couple of years is, in order to fully achieve maximum health for all, for any person, any community member, it requires more than just physical and behavioral health support. It also requires what's called health-related social needs and supporting those needs. So that's an acronym that you may see in here, HRSN, health-related social needs. And so one of, some of you may not be participating in the social care network. So this slide is really meant to give you a little bit of perspective of the social care networks. This social care network is the idea and program of the social care network is part of New York State's 1115 Medicaid health waiver, focused on New York health reform. And it's a $7.5 billion program. And it is the social care network component is just one piece of that. And so that's really where the focus will be today. This initiative, the social care network, is happening all across New York State. So on the next slide, when we get to that, I'll share with you what some of those regions look like. Our Care Compass is the lead entity for the Southern Tier region. So I'll give the background of what those counties are. But the objectives of the social care network are the same all across the state. They're trying to be consistent in how this is rolled out. The rules, the screenings they use, every component of it is consistent across the implementation across the entire state, not just specific to here. So with the social care network, the objectives, so the first one here, to increase capacity to identify unmet social needs and navigate members to services in different domains. The next one there, to reach a broader set of Medicaid populations with enhanced services like medically tailored meals, things like that. I'll share a high-level summary of what these services are so that you are familiar with the offerings of the services in the social care network. The third one, as I mentioned in the introduction, to integrate physical, behavioral, and social care systems through shared data and technology, being able to bidirectionally communicate across different providers that may come in contact with people so that we could help assess needs of members and get them engaged in this program to provide support. The fourth one, facilitate sustainable Medicaid reimbursement for community-based services that improve health. One of the main initiatives or outputs, I would say, of this program, the CMS, the Center for Medicaid and Medicare Services, ultimately would like to see social care services become part of the overall cost of care for the Medicaid program. And so right now, this program is helping to deliver these services, collect the information on where the impacts are, what might need to change as part of that. But that's their ultimate goal, is that it's part of the overall cost of care. And I'll talk about that more later when we get into the sustainability component. And then lastly, improve outcomes and health equity across New York State through improved experience, use of preventive care, and reduced avoidable hospitalizations and institutional care. This is a map just showing the different areas. Again, there's 9 social care network regions across the state. Care Compass is facilitating the Southern Tier Social Care Network. So that's this peach area. So Tompkins County, Tioga, Broome, Shenango, Otsego, and Delaware. But again, these other areas are led by other entities across the state, but similar requirements in implementing the overall program. Okay. I shared this here. This might be cut off at the top. Okay. I wanted to give perspective of what kind of a high level view of workflow, since many of you may not be aware of the social care network and services, either as a provider or coming in contact to communicate with members. So this slide depicts the member journey. So how to engage in the social care network program and what that looks like. And so that's really the intent of this, is just to give a little bit of perspective. So initially, all that first step with the social care network starts with a screening. The member is screened for health-related social needs, to identify where there might be some needs in areas of housing, food, transportation, employment, educational, and then some optional interpersonal safety questions if the member chooses to answer them. If there are needs identified from that screening, the member is then asked if they would like to receive support and help to connect them with services and to continue on in the process with the member. If they say yes, then that moves the member into a discussion with regarding eligibility for the services, so that we could best understand what services the member is eligible for, and then take whichever workflow or pathway to connect them to those services. So some of the components with this are social risk factors. For example, in the transportation realm, maybe somebody doesn't have access to a vehicle or doesn't have a driver's license. That would be identified as a social risk factor, and hence why they might have an unmet transportation need. Another example might be maybe they're homeless or at risk of homelessness. For example, they received notice that that they may lose their housing. So something like that would also be identified as a potential factor. There's population criteria that New York State has to be eligible for some of these services. So, for example, children under the age of 18 that have high-risk chronic conditions, that's one of the focus population criteria. And then there's a handful of others as well that we're looking to see if the member is eligible from that perspective. And then, of course, some of these services have clinical criteria that come into play, like asthma, for example, or chronic conditions, diabetes, those kinds of things. Again, staying high level, not getting into some of what diagnoses people have with different health challenges. Based on that eligibility assessment, and depending on how the outcome of that, so members that have Medicaid fee-for-service or do have Medicaid managed care, but maybe they're not in one of those enhanced populations, then that member is connected to existing services through either local services and programs, federal or state programs. And I know a lot of that already happens today. The difference is this has a payment that gets associated with it for organizations that provide this. So that's one of the main differences. If the member is in one of the enhanced populations and is eligible based on this assessment, they can be referred to receive any of the enhanced services where they had unmet needs. And again, on the next slide, I'll show you examples of what those are. The areas that the social care network focuses on are housing services. There's nutrition services, so like medically tailored meals, nutrition counseling and education. So I'll go over all of those. The member would receive that referral, and then they would be connected to an organization that actually provides that service. And there may be multiple organizations, because if you think about, like I saw Allie Evans on the call, Allie's organization provides the nutrition services, but she's doing woo-woo. But her organization doesn't do the housing support services. So if a member has unmet needs in both nutrition and in housing, they might be connected to multiple providers in order to help meet their needs and provide those services for them. And then at the end of this is a referral, to keep working with the member through the process until that, in some cases, either the member their health is sustained, they've got the support they need. The duration of the service, in some cases, the services only last for 6 months. So the idea is to support them with other services, and I'll give an example of that. But to keep walking with them through that process as they receive services. And then when the social care network services, the term of that ends, where some of them have terms, they'll be connected back to local, state, and existing resources. I have one more slide and then I'll pause there from the overview perspective. The next one is just to give you a perspective of what some of these services are. So again, the screening it starts with that screening and then the navigation when there's unmet needs. This box on the right is all these enhanced services. So if a member does meet the eligibility criteria, they have unmet needs in those areas, these are some of the services that they may be eligible for. So like nutrition, I mentioned a few of these here. The food prescriptions is like food boxes or food vouchers that support the members' nutrition support for a 21-day supply of meals. Or gives them a voucher so that they could go purchase items to support in addition to other programs that they're eligible for, like SNAP benefits and such. Pantry stocking is, again, just a supplement to existing support they're receiving. So that's a certain amount of canned goods, not necessarily dairy or meat or anything like that, but other goods to support them and make sure they have enough food supply for them and potentially their family if they're eligible. Then there's several housing services. So there's some home modifications and home remediation. So like mold and pest removal, that's part of it. Asthma remediation, maybe purchasing supplies for the home for somebody that has asthma and is, has an unmet need there. The biggest one that we've been providing besides the nutrition services to date is support in rent and temporary housing. So this is rent and temporary housing support for up to 6 months, and that can include back rent that may be owed. And if a member is receiving rent and temporary housing, they're also eligible for utility support assistance if that comes up with a need. Those two go hand in hand together. And then there's some other housing services here. Typically, where there's unmet needs in housing, they're receiving many components of these housing services, usually not just one or two of them, because they do go in tandem together. And then transportation. So this is transportation, not to get members transportation to clinical appointments that already exist today. This is more to connect them to the health-related social needs services where they have needs. So for example, if they have a housing unmet need, this would be to connect them to maybe go see a few housing options that their navigator has found for them. So it could be something like that to actually meet with either a housing navigator or to actually go look at housing to help move that process forward with a member. And then, of course, also social care management. So this is like care management services, but from a social care perspective. So helping the member walk through maybe applications, like if they had a transportation need and they are going to fill out a driver's license application and they needed support with that, you can help. So there's payment to help provide that support to the member. Through this program, there's payments available for all of these services for the providers that contract to do them. And I know several of the people on the call today work with organizations or work at organizations that provide these. So this is up and running since January 1st of last year, 2025. So I'm going to pause there. So that's kind of the main overview of the social care network, just to give you a little bit of perspective of what's involved here. Can I answer any questions at this point before I get into the data? Okay. I'm going to keep going then. Okay. Oh, what's happening? Hang on a second. Part of my slide was cut off. There we go. Okay. And you guys can still see my slide deck, right? I didn't. Okay. Okay. So what you're looking at here is now we're starting to get into some data. This is for all of the counties that are part of the Southern Tier Social Care Network, with Tompkins being one of them. The slides after this really just go into the Tompkins County, but I wanted to start out with that, that 30,000 foot view. So since January 1st of last year, so far it's actually over 10,000 members that have been screened to date. The reason this is lower, we have some data that's coming in from our health system partner, Guthrie, but some of that data hasn't made its way to the IT platform that we utilize. And so I know from New York State that there's over 10,000 members that have been screened so far for health-related social needs, but just not all of that has come into our system yet. I heard today that that's supposed to be starting to happen later on today. So hopefully at our stakeholder meeting that we have next week, we'll be able to actually share true representation of where we are. So this is more over 10,000. I just don't know the breakdown of what that looks like across the county. So I said, let me just show you the data that I know from our system where we're at. So this has 8,963 with 1,100, almost 1,200 of those being from Tompkins County members. On the next slide, I share with you, I took a look at where the zip codes, where the members are residing that have started to receive screening. And I know some of these zip codes that are at the top kind of blended together the way my slide deck is showing here, but it's probably not going to surprise you all that most of that, just under 1,200 screenings, is Ithaca, right down in Ithaca. So 779 of those there. The bold face on the bottom are like the highest number where members have been screened. So Freeville, that had a good amount. Groton had a good amount, and then Newfield compared to maybe 15, 20 or so with some of the other counties. So I thought that would be of interest to you, where that looks like. One of the things I was going to inquire about is I know that there's still not a lot of awareness of this program, both from members and also even providers that may do some of these services. And so one of the questions I was going to bring to you is, what ways have you found communication and outreach? Like what methods have you found to be successful for other programs where you're rolling out new services or new initiatives in Tompkins County? I would love to hear that because I know we're going to want to do some kind of focused support in Tompkins to get more awareness out there, especially in some of the more rural areas that are outside of the Ithaca area specifically. So I'd love to hear if you have any suggestions there.
Dawn, Catherine wanted to know, as far as the network, are there more agencies in Broome County or just larger healthcare providers that are screening members?
Yeah, right. Great question, Catherine. So for Broome, it is mostly a lot of the high volume there has been driven by Guthrie Lords. So the Guthrie Enterprise, they have started screening across all of their primary care sites since April 1st of last year. And they screen everybody that walks through their door for a primary care appointment, regardless of insurance. And so a lot of Guthrie Lord's primary care practices are based in Broome County. Tioga is another one. And so backing up to that slide, that's why Tioga is also very high from that perspective. The majority of that is from Guthrie primary care providers. So I don't think it's necessarily the number of providers or the number of health-related social needs providers. I mean, certainly that does have an impact in how many members are engaged with the social care network, but I think a lot of the main driver is the Guthrie Lords and the Guthrie Enterprise overall. Good question. Any thoughts to share on, ways that you've been successful in, communicating about programs and new programs in the region?
Dawn, there's a question, or there's a comment and a question in the chat. The problem with making referrals for me at the moment is that I'm getting the message that agencies are at capacity for highest need, for example, housing. Are there providers actually available now?
Yeah, that's one of the challenges I was going to share later on in the slide is, yes, we have a good amount of providers specifically in Tompkins County for services, but many of them are reaching capacity for services. One of the ways that we're addressing that is just 2 weeks ago, our board approved another round of capacity funding. And so we have, I think there were 4 housing providers that received capacity funding through the program. I think one of them is already existing, but they're adding another resource to support building more capacity. And again, that's specific to Tompkins County providers. I think there were 4 nutrition providers, and then I think 3 transportation ones. So we're hoping that brings some relief to some of the challenges today with where we're running into capacity challenges. I see, Bihar, have you used local newsletters and listservs? So I know we've done a school communication for Tompkins County. I think we've done a Department of Social Services, but I don't think we've been on any other listservs or anything like that. So that's a great recommendation. And then newsletters, no, we have our own Care Compass newsletter, but we have not gotten into any other ones that are available. So certainly if you have recommendations there that have that are seen by either members and or providers, that would be very helpful. So that's a great recommendation. Yes, so DSS, presentations with DSS. Yeah, word of mouth. One of the things we're focused on right now is just trying to get more flyers out there at different sites like post offices, laundromats, dentist offices, locations like that to help build awareness. And then just being able to share some of the services that members are eligible for. So those are good recommendations. I do think we need to do some more presentations, particularly for those that maybe aren't providing services so that they know what the basic scope is. So like something like today, where you're hearing about the background of this and then how to connect a member to the social care network. And I do have that in a slide or two. So thank you for that input. Okay. Okay, so what you see here, so this looks at just Tompkins County, so just the members, and I've gone back for the last 6 months of data. So this looks at of the members that received the health-related social needs screening. This looks at where their unmet needs are across these different categories. And so this isn't unique necessarily. So I think most cases, on average, members have 4+ needs for those that are screened. So it's not necessarily unique here, but it gives you areas of where the highest need is showing up. Consistently, food has been near the top. Social support, let me talk about that real quick before I go into the other domains, but this is really the care management. Where do they need support and being connected to other services? So it's like the general category. And then you have food, housing, transportation, utilities. You see these all, but this has consistently been food as the highest need. I don't think that's going to surprise anybody. Housing, second to that, transportation and utilities have been pretty close. And then the rest pretty much similar across the way, but not as much of a need in those areas compared to the rest. There's a couple of components in this data I want to make sure to talk about. So for example, this 95% for food in November. So keep in mind that was after the SNAP benefits paused at the end of October, right? So that probably won't surprise anybody that that jumped up quite significantly in the month of November. The September data, I want to share why that's so much lower compared to the rest of these. So we mentioned earlier some of the health system screenings that are happening. And again, those have been happening since April 1st. However, those were not coming into our technology platform until September. That was the first when all of those screenings that were done since April actually came into our system. And that was just part of some of the challenges in what they call off-platform screenings that are being done. Organizations that provide the services, more than just the screening service, are required to use the IT platform that we use, which is Unite Us. It's a closed loop referral system. And so September was this first time where all of those screenings outside of our IT platform were actually entered and got pulled in. So you see quite a difference in the numbers, and it's these screenings didn't happen in September, but that's when they actually came into the system. So it kind of skews the data a little bit, but I did keep it here. You still see the same food as the highest need, the housing as second to that, and then of course transportation. So I do want to share a little bit of background here. I see a couple of chats, so let me. Yeah, some of the, I can understand the frustration and some of the requirements of some of these services. Like, for example, we've had organizations ask us about the utility services. The way that those are structured right now is the member has to be receiving rent and temporary housing support also. And if they're not, then they're not eligible for utility services. And these are rules that are passed down by New York State as part of the program. So we could advocate for where we need change, but ultimately, it's up to them to decide, what they change moving forward in the program. So I hear your frustration, and we could, bring that forward to New York State. In fact, we've asked them to try to separate it. And there are some hard rules that New York State and actually CMS, because again, they're the ones co-doing the program together. There's some hard rules that they're not willing to change, even though we all know it's not designed the best way to fully support members that have needs here. Okay. Now we get into, so I have 4 slides just on the actual services and how many members currently are receiving services. Again, these are Tompkins County members. Many of these are not unique. So let me explain this. So per line, that's an actual service, and those are unique members in there. So you're not going to see people double counted, but across these services, so together, there is overlap for some of these. Like, for example, somebody receiving care management. So that's what CM is. I should have spelled that out. Somebody receiving care management may also be receiving support to education assistance. And so there is some overlap across rows, but not within the row. Going back to that workflow that I showed a couple of slides ago, so members that have Medicaid fee-for-service or are Medicaid managed care but not eligible for the enhanced services through this program, so they are connected to existing resources. So there's 148 Tompkins County members that are receiving that navigation support through that. The other one I want to highlight here is this 373. So this is the enhanced care management services. So this is members that do have the Medicaid managed care and are eligible to receive those enhanced services. So they are receiving support for care management. There's 373 of those. Quite a few members in Tompkins County are receiving support, and that's just that one focused area. The next one is around housing. So again, same concept. Within the row, there are no duplicates, but across services, particularly in housing, it's likely that members are receiving more than one of these, depending on where they are in the journey of receiving support for the social care network. So as I mentioned earlier, rent and temporary housing, especially in Tompkins County, right? This has been Tompkins County by far, since the services began being provided early last year, has really, I would say, done a very, very good job in getting these services implemented. And I think that's why we're at some of the capacity challenges that we're at. They had a good jump start on engaging in these services and get going. And many of the organizations providing these services, they already work with members today. And so they knew who to engage to get the need to them as quickly as possible. So you see that the rent and temporary housing, and then a large number across all these different services, again, specific to Tompkins County. Next one is nutrition services. So again, unique across each of these services, but most of these, if you're receiving like food boxes, you're typically not receiving any of the other things. So I guess you could receive cooking supplies. So there is some overlap across all of the services, but not as much as housing. So the nutrition counseling and education is, engaging with a member to understand where they need support, maybe meal prep, what kinds of limitations might they have, and those kinds of things before they're engaging in some of these other services, like having medically tailored meals delivered. You've got clinically appropriate delivered meals. So that's more not specific to members with certain chronic conditions, but more open for other members as well. Food boxes, it's just the ingredients to make your own meals, but it's for members that have the ability and the supplies and resources at home to be able to cook their meals. So they have a working oven, a refrigerator to store things, pots and pans, things like that. And if they don't, then they're often eligible for cooking supplies where those, at least the refrigerator can be provided for them, and some of the cooking supplies like pots and pans, dishes, cutting boards, those kinds of stuff. It doesn't cover an oven necessarily, but it does cover a microwave to heat up meals and that kind of thing. So again, we saw a very large increase, particularly in nutrition from November on, and that was across all 6 of the counties. And then one more, transportation. So again, this is transportation to access health-related social needs services. So it's not medical transportation. You've got 2 different areas here. So private transportation, and then of course, public transportation where that's available. So this is specific to Tompkins. We do have several providers that just came online in the last couple of months. So we're starting to see the network grow with capacity to be able to provide these more. And then there's a few more coming online soon based on the most recent capacity building awards. I see another question. It looks like Nicole got it. Okay. So earlier, like in the chat where I think it was Catherine that mentioned the challenge of capacity, where capacity of existing providers is limited. So these are current barriers. I've listed 2 here where we're having barriers with access to services. One of them is not having even enough providers for some of the services. So we have a good amount for rent and temporary housing, though we still need more. But like some of the services, such as the home accessibility and safety modifications, specifically in Tompkins County, home remediation services. So that's like grab bars for showers. It's a ramp for handicap accessible or wheelchair accessible. So it's things like that are covered as part of this. Most of these services for Tompkins, we have one provider. So that's a barrier that we're seeing. And it's not just specific to Tompkins. There are other counties where there's only one. So for this program, New York State, their guidance to us was to engage as many non-for-profit community-based organizations as we could. And so we have done that. when it comes to providers, we're actually expanding now to the for-profit providers. We tried to be very limiting in that because what we didn't want to happen is engaging, as many for-profit providers and then pulling those services away from the non-for-profit providers. So our network is primarily non-for-profit providers, and we're very proud of that. But with some of these services, we just don't have enough. So we have started to look for-profit providers so that we have more than one provider available for these services, and hence that we can meet the needs out there. The other, like I said, the other one is capacity of the existing providers. One of the responsibilities of the social care network leads is to help build capacity for these services. And we have funding that we're able to utilize to do exactly that. So the way we've approached this for all of our rounds is to put an RFA out there, a request to apply for funding. And that way the same opportunity is available. And then each time those are scored and awarded. Most recently, so just 2 weeks ago, we announced our recent awardees. There were 17 applications awarded overall across our entire 6 counties. Specifically for Tompkins County, 4 organizations were awarded funding to increase capacity in housing. 4 were awarded for nutrition, and that's like the food voucher. It was the food boxes and clinically appropriate home delivered meals. So it was mostly in those areas where we have challenging capacity issues there. And then transportation, there were 3 organizations awarded to provide transportation services. 2 of those is actually providing the provision of transportation. And then one of those is more the the coordination of transportation to connect members to the most appropriate transportation to access services. So that's one of the ways that we're addressing those, the capacity challenges. And we're hoping, since many of these organizations that were awarded are already organizations providing services today, but they're expanding capacity with additional resource support. So we're hoping they could fill those positions quickly and expand on services that they're already doing. So we're hoping that relief is coming for the network. We're trying to get them through the process as quickly as possible. And those agreements started February 1st. So they're live and active as those organizations are ready to roll. So
can I ask, when you're talking about capacity building here, are you talking about additional staffing for these organizations or the actual dollars? There's like a cash flow problem that I've heard about repeatedly.
Gotcha. Great question.
Thank you.
Yeah, these are actually, so there's 2 different things. So the capacity building that I'm talking about is helping to provide funding to organizations to increase capacity. And what that means for most of them is resources. With these services, you don't know how many referrals you're going to start to see. And so providing the funding support for the resources so that they're going to be funded and don't have to rely necessarily on having enough referrals come in, especially as these networks build and provide more services. It provides that support to them so they can ramp up that capacity over time. So that's the capacity that I'm talking about. There's other things that you could do for funding. So there's resources, which is what the bulk of the capacity funding is. In the case of transportation, we have had some organizations request a vehicle. So a vehicle can be purchased. Capital funding can't pay for building or infrastructure funding can't pay for capital bills, but it can actually pay for a vehicle. So that's okay. And so one of the limitations of an organization expanding capacity was they didn't have a vehicle to do that. And so they submitted for that in their award, and if they were awarded, that was funding that's allowed. Other things I've seen, so people that are endeavoring into the food voucher area, so there's special printers to print vouchers. You need a process to follow up on the unspent funding from that. And so some of that administrative burden, those are things that could be asked for as part of the capacity funding. What you mentioned, I think, Jessica, that was your question. The other thing that you mentioned is In providing services, sometimes what we've seen, and more frequently than not, one of the barriers to expanding capacity is that cash flow. And so we have a program, we recognize that and we hear that. So we do have a program where if organizations are providing the services and cash flow is an issue, we can work with them on, it's a 0% loan that they're given funding to kind of help get them going for a few weeks of those services. And then that automatically will start to repay itself from the cash flow basically will rotate because now you've got that cash flow available. And then we deduct 5% out of every payment that we pay our providers so that that loan is being paid back, but that solves their barrier for not having enough cash flow to provide services. Because when you think about it, some of these rent and temporary housing services, you're paying out thousands of dollars just for one member to help one member. And so you start doing 10, 15, 20 of those. And I know some organizations are serving 50 or more a month. You've got a lot of money going out the door. And so you're reliant on having that cash flow and being reimbursed quickly. And I think you can ask many providers on the call here that are doing these services. They are seeing that reimbursement back from Care Compass, usually within 1 to 2 weeks, so that they're getting that cash flow back to them because we don't want that to be the barrier.
That's great news. Thank you for explaining all of that. There's a lot of ins and outs, and it sounds like really creative problem solving. I'm still hearing that being the reason that I'm not able to get folks what they need. And when you know, sort of circle back to your original question, how can we help get more folks screened? I'm not inclined to put a family through that right now, knowing that it's not actually an option. So
Yep.
This is just like overworked social worker on the ground feedback. Like I can't do that with someone if it's not going to work. So that's where I'm at, with so much love and hope and respect for what you're doing. It's been so miraculous for families that it has worked for.
Good. I'm glad to hear that. I'm hoping we get more to a point because now we've got more and more capacity funding out there. Organizations are ramping up. And so we're helping to minimize that time that members have to wait for services so that we can be more responsive. Okay. What are we doing on time? Oh my gosh, it's almost 1. Okay. So a couple more things here. So I know many of you have asked, well, I'm not doing services, so how do I connect somebody to the social care network? So that's what this slide is meant to do. So there's a couple different ways. So first of all, if you know one of the organizations in Tompkins County that's doing the screening and or what we call social care navigator services, which is the screening, the eligibility assessment, the referrals, like they're doing all of those things. You can definitely connect the member directly to one of those. We have a provider list that we share, and we will share that so that you have the list of providers. In fact, I think I have it up in the background here just to show you what it looks like. So like, for example, this lists all of the organizations doing screening services who support Tompkins County. And then there's a resource name for the main contact for that organization if you're not already familiar with them. So we can share that with you. And, it lists all the other services here. So we'll send that following the meeting. Let me go back to the slide deck. Another way is, so we have a Care Compass collaborative website that actually has a self-screening for the health-related social needs services right on it. And I've included that website link here. So you could have the member, you can send them to the website and they could walk through that on their own. That is a self-screening, so there's not somebody there to walk them through the questions. So if you think that would be more beneficial to the member, I would say have them either connect them to a local organization, or you can have them call the Care Compass Social Care Network. I've got the phone number here. We don't have somebody physically answering that phone, but we check that for messages 1 to 2 times a day, usually in the morning and usually in the afternoon. And then we'll follow up and call back that member within 1 to 2 business days. So that's been happening for the last year. So those are different ways that you can connect a member to begin the process of engaging with the social care network. All right, now let's talk about impact. Actually, I'll pause there before I talk about impact. Any questions that you haven't had a chance to ask so far? Okay, I will keep going. So we have a stakeholder meeting every month that we open up to share about progress. We have community organizations, share background of themselves, because with 6 counties, there's definitely organizations providing services in the network that maybe don't know each other. And so you're not sure, what kinds of services do they do? Do I trust the services? And so it gets to help build some relationships within the network. Last month, we had Emily Engel join us, and Emily is the director of the Bureau of Social Care and Community Supports from the New York State Office of Health Insurance Programs. I know it's a mouthful. So OHIP, I think many of you have heard the abbreviation OHIP. So Emily is the director specific to the social care component of that. So she's really New York State's lead on the social care network program. So Emily came and shared with us some of the state level impacts. So again, this is a state program. So it gives you perspective of, how this is going across all of New York State. So this was through the end of December, I believe. Through early December. So this is over 500 Medicaid members have been screened across all of New York State. There's, with the screening and providing of services, there's what's called a social care navigator role, who is really meant to be kind of like that main point of contact through the entire process when a member first engages with the social care network. And so across all of New York State, there's about 3,000 social care navigators connecting members to services in all areas. So it's aggregate amount. There's been a lot of network build that's happened today. We talked a little bit about capacity building already. So across New York State, 1,200 plus organizations have contracted to do various components of the services. So an organization may choose to just do screening. They may choose to do like the social care navigator role, which is screening, eligibility assessment, the navigation, and then the referrals and follow-up. Or they may choose to do enhanced services. So maybe just nutrition services or housing services, or you could do a combination of those, whatever your organization decides. So again, over 1,200 across all of New York State. 435 of those offer at least 2 or more of the services. So not quite half, but almost. Across all, so the capacity funding that we talked about, that's funding was given to all of the social care network lead entities, again, to distribute, to build capacity. And so we've all been doing things, but we're doing it differently. Some have a different application process. That was all up to us to do as we decided. But the point is, we all still have requirements to distribute that and help build capacity for these services across the network. Over 500 organizations have received capacity to expand services. I think for Care Compass, over 40 organizations out of 79 we have received capacity funding to expand services. And that's across all domains. So that's in the housing domain, nutrition, transportation, and then also social care navigation because of the number or the amount of work involved for the social care navigators in this program. So that's some high level impact from a New York State perspective. Some of the things that I think one of the questions was about measuring impact with this program. So most of the impact to date has really been qualitative. So member stories, how it's going, hearing stories from members of how the services have helped them. There are so many success stories that have come out of this. It's wonderful to hear, but that's just one part of it. I think we're all waiting for that data component. That's the quantitative data to say, here's the impact of what the social care network has done to date. And we as Care Compass, we don't have that. The state, New York State, and the managed care organizations are the one that are going to have the true data impacts, how it impacts members' their clinical health overall. Has it somebody that may have been utilizing the emergency room often, are they using it less now? Like, they have that data, and so they will have the true quantitative data impact of this program, and we have yet to actually see any results of that data yet. Obviously, it's quite complex because there's a number of components that go into that. But what I could, we have the member screenings. We know how many assessments, eligibility assessments we've done. We know how many members are receiving services. I shared that data with you earlier, and that's all great, but we don't necessarily know impact on their health. What's the impact to them? And we really need the data from New York State and the managed care organizations to help with that. One thing that we will get and are rolling out is member experience data. So one of the requirements of the program is to collect member experience from a survey, an optional survey, so they don't have to fill it out, but that will begin to give us the first look into, how are these services, are they helpful? Are the resources, are they friendly? Are they getting everything they need? All of those things. And so that will be the first quantitative data that we have that will be tied to impact of these services. But again, the bulk of that data has to come from New York State and the managed care organizations. I do want to, at this point, I think it's a good point or a good time to ask for member success stories. I have a couple I'm prepared to share, but I want to ask if any of you on the call have any member success stories that you would like to share, since you're, more involved in actually physically providing some of these. Does anyone have any? John?
Yeah, I don't know that I would share like a specific member story because I have a hard time generating them in my mind right off out of the blue. I need a moment to look through, but I would say in general, so we're one of the providers and we've been doing it, I don't know, almost a year now. And I would say for us, particularly having 211 at HSC, there has been a challenge for the challenge for us sometimes is that when you make referrals, you sometimes don't really have something to give to folks. You're like, well, you could try this, or, this might be an option for you if you're eligible. And one of the things that this program has allowed us to do is in some cases, not in all cases, but in some cases for the people that are eligible and meet the criteria and have a need that can be supported, it does provide more ability for us to be able to respond, whether that's through one of the enhanced services and actually be able to put some money towards something, or if it's just to be able to direct to our social care navigator who could spend more time and be in more depth conversation and thinking with someone than, say 211 can do, where the phone keeps ringing and, there's other clients to serve. So though there have been some challenges that Dawn pointed out, I think that, we're heading in the right direction. I think Care Compass has been a really good partner for us in working through some of the initial startup challenges. We often joke like, this really, like, if the state really built this the way we would have wanted to, this would still be the pilot year. We'd still be like in the zero year for this project. And so I think that the amount of progress we've made is really good. I think there's always room for improvement, and certainly we've touched on some of that today. But if we think about it in that regard, I think we've done a lot in our kind of initial year here, and hope in the next year to come we'll be able to do even more as a region.
Great, thanks, John. Yeah, Chris.
Thanks, Dawn. Yeah, just quickly. So I had a nice encounter a couple of months ago. I was at some fundraiser and for Family Reading Partnership, I think, and somebody was, we're just introducing ourselves, and somebody said, "Oh, so you're at Extension, so that's great because my daughter got the food boxes, right?" And she said, and what was really special about that for her was that it enabled the daughter to be social, right? She'd been embarrassed that she couldn't bring people round, and now she had food boxes, so she had snacks to give somebody. So it had changed her life in this whole other way on top of just food security. So it was a nice little story, yeah.
I love that. Thanks, Chris, for sharing. And I see Catherine added one in there about navigating clients to get rent paid so they avoid eviction. There's several members that they're receiving food boxes through the partnership, and then transportation support as well. Allie, yes.
So a different strategy that we're using is our relationship with Care Compass and SCN is to be another opportunity for folks who need services to get nutrition from us. We have home delivered meals and nutrition education and nutrition counseling. We know that it's not going to be a bazillion people because of the other programs that we have and the other people that we're serving and other things, but there are some people that traditionally fall through the cracks, and those are the people that we're trying to get. So our strategy has never been to like save the world, although yes, that is our job in real life. But with this particular project, it's to make sure that we're capturing anyone else that would fall through the cracks. So it's a much different level of focus. It's still focused, it's still on our mission, but it really ties to trying to make sure that we're available for all the older adults that can possibly get in. So it's a different way of doing it, and it's, you know, it's a little less stressful.
Yeah, it's another tool in your toolkit for services to offer, right? for members that you could support. Thank you for sharing that, Ellie. I do have one story I'll share, and it gives a little bit of an example of some of the services and how it's impacted a member. So similar to what Chris and Catherine have shared already, and John. So this is a member, early 30s, with chronic conditions. Let's see. The members in the enhanced population, so eligible in one of the populations that are eligible to receive services. The member is unable to work due to disabilities and was screened in mid-September, had 3 identified needs that came from that screening, and one was in the housing and food area, and then the care management components. The member was behind on rent and worried about being evicted. The member is eligible for rent and temporary housing support along with other housing services. And the member was also looking for help with SNAP enrollment and cooking supplies as well. In October, the member was supported with back rent assistance for 6 months, so May through October. Has an appointment with TAMF to get temporary assistance with rent moving forward, given his circumstances. And also the member was supported with cooking supplies to assist with independent cooking at home. The member continues to receive enhanced care management and tenancy sustaining services through the social care network, and is also currently receiving SNAP benefits. So it gives perspective of how these services could be utilized with other existing services like SNAP and TAMF benefits. So it's okay that they're all used in combination, and it's just trying to wrap support around the member as best as possible to support their needs. So another success story there. And I'm aware I'm at 6 minutes after, so let me try to wrap up with a couple remaining screens. So with the program, with this social care network program being connected to the 1115 waiver, that waiver currently is set to expire in March of 2027, so March 31st. However, New York State has been very clear that what they built with the social care network, the funding to get infrastructure going, the support to get these networks built across the state, they didn't do this so that this program could end as of March of 2027. They did it to get going on it because they see the value. They also, in the terms and conditions for the waiver, if you were to look up the terms and conditions, the expectation from CMS is that social care services become part of the overall cost of care after the waiver is set to expire. And so, yes, this is a pilot period, I would say. And John, I wish we had another year where it was really early on in the pilot. But right now we're all marching to roll these out and connect with as many people as we can to get them support that they need. I don't think this program is going to end. The question for me is, what is it going to look like? Will it be all of the services that are currently available today, or what will they change? So this slide, what you're looking at here, this was shared to us by New York State. It gives perspective of, on the left, I won't read these just given where we are with time, but the progress that's been made and what their go forward aspiration is. I do know that they are pursuing a no cost extension of the waiver. That would be the ideal. Best case is extend what we're already doing, no cost, because I don't think any of the SCN entities have spent the amount of money that or have provided the amount of services that New York State had hoped at this point, because it took some time to build all of this. And so just extend the program and extend the waiver with it. So that's what they're pursuing, but they have to have a backup plan, right? And again, it's written in the terms and conditions of the waiver that these services get integrated in with the overall cost of care for Medicaid members going forward. So I don't think it's going away. The question is, what is it going to look like? There's no doubt the screening component is going to stay. Again, New York State didn't invest in that time to acquire the screening that is used all across the New York State to then change it in March of 2027. So there's no doubt that that's going to be what's used. You got to do an eligibility check. You got to do connection to services. The question for me that's most open is what do those services look like? Will they continue providing medically tailored meals through the program? Or will that go back to in lieu of service in some of the specific plans? What does that look like? So I think New York State is trying to figure that out. But they've been very clear, and they shared it on the stakeholder meeting with us. Like, they built this to stay. It's not like the district program where there was no sustainability plan. They built it in. It's written in the terms and conditions, and they're doing everything they can to continue the infrastructure support that's been put into place today. But the question is, what change is needed? So if one of the questions is, how do I engage with a social care network? So if you offer any of the services and are interested in joining, not just Care Compass, but I recognize there are other regions that your organization may support. I did include links. So there is a website that New York State has, and it could take you to each of the SCN entity websites. But if you are interested in Care Compass, Amira is our community engagement specialist. She's the one that I would reach out to. And then I also did have a couple, if you're looking for more information, New York State has a page for social care networks. It's got a lot of information on it, both from a provider aspect, from a member aspect, services, all of that. So I think that's a helpful tool for you. There's also a webinar. It's about an hour long from a provider perspective that New York State had. And then also, if you want to hear more about the overall 1115 waiver from Amir Basiri, I included a link for you from the Medicaid conference from 2023. And it's about 35 minutes into the recording. It gives you perspective of the overall waiver and what's involved, because the social care network is just one piece of that. So that's that. And just a couple from a Care Compass perspective, for Care Compass Network, we do have other initiatives outside of the social care network that we're doing. Many of you may already be a partner from an open network perspective. We invite any organization. You don't necessarily have to be a not-for-profit or hospital, but just some kind of community healthcare provider in the region that we serve. So it is a 10-county region from that perspective. So slightly larger than the social care network region with the 6 counties. And this really stemmed from relationships that we had from the district program several years ago. So I did include, some overview for you here just on, I think there's 3 slides total. just trainings that we're offering. We offer trainings for organizations that are in our open network that are free of charge. So I listed a couple of those here. If you're not an open network partner already, you could easily reach out again to Amira. We could get you connected. It's a simple agreement to participate. There's no, I don't ask for monthly report narratives or things like that, or that are going to be administrative burden. It's just being able to provide resources to the region. So there's some of those that I listed here for you. And then what I tried to give you is a little bit of perspective of other programs that we're doing, besides the social care network. So we have, from Care Compass perspective, we have our open network, which is really any organization can join and access trainings and newsletters and things like that to help share information, to collaborate and grow together. We've got our social impact pilot program, which is very similar to the social care network. This was actually implemented years before the social care network, but the same concept. It's creating networks to support the health systems that want to engage in this program, to help provide social care services as part of that, and help provide more support for their members through their VBP contracts, their value-based contracts that they have. We do offer some grant writing and custom solution work, though we haven't done a lot of that lately with everything that's on our plate right now, but it is still there. The Stitch is it's a Southern Tier Integrated Collaborative Hub. It's a group of stakeholders that meet once a month to talk about behavioral health initiatives, and that helped inform a lot of the new service offerings that we're starting to develop. And I share some of that over here on the right. So we're going to be venturing into a managed service organization. One of the things that we've heard repeatedly is some of the administrative burden that our community-based organizations are challenged with, and with funding being pulled away in many areas, what could we do to help support that? We're not ready to roll anything out yet, but we are starting to pilot what that could look like, where the needs are. For example, I think one of the easiest ones is to kind of talk about is the human resource perspective. Organizations are of different sizes, and not all of them have the ability to staff a human resource department to help with hiring and policies and administrative load from that perspective. And so is there like a shared service model that could support organizations to help reduce costs, but get them support in that area? Just one example. And I don't know that one will be in the end, but that is one example that we've heard from organizations, or even supporting, if you have a finance position that, maybe your finance lead is leaving or retiring, and, while you're hiring and going through that process, what kind of support could you be receiving to help with that transition? So some of those types of things. Our board has said that they want to do some kind of assessment on where the regional needs are relative to housing and transportation. The social care network and the services I overviewed for you there, it doesn't solve the housing challenges that we have across the state. It doesn't solve the transportation shortages where some counties no longer even have a bus service operating anymore. And so if Care Compass is going to invest in these areas, we need to understand where are the regional needs in that. So we are going to be looking at an assessment to understand that, to bring a recommendation forward to our board. We have some behavioral health work that's happening. The next slide, I gave a little bit perspective of what that looks like in the funding. And then we're also doing some work with community planning and promoting regional standards. These are things that we've heard from our board of directors that are areas that would be helpful to the 10-county region. And just this last slide kind of gives you perspective of funding that our board approved. So, in like that behavioral health realm, our board has approved $26 million to do some work in the workforce to help expand workforce, particularly with the peers. So some of that work has already been happening. We have a telepsych program we're trying to bring up off the ground to support primary care providers in providing guidance for some of them for behavioral health members that they might be seeing. You also have funding out there to expand best practice programs in the area of behavioral health. So there's a lot happening in here. A lot of it is just getting going though. So, if this is something you're interested in, I think there was a behavioral health Tompkins County meeting maybe 2 weeks ago. So we're doing meetings in each of the counties to kind of understand where some of those needs are and what might be beneficial from a behavioral health investment perspective. So there's that. The MSO, our board approved 3.3 million to help with that. And really we're at the point where we're just establishing what are the needs and start to identify some pilot locations to begin to build out that framework. So really just getting going here. It's not, I wouldn't say it's operational. In fact, we still don't have staff for that yet, but at least have one person to get going on that. I mentioned the exploration of the housing and transportation. So the board approved $1 million, but we just haven't done that assessment yet. So some of that work will be happening. And then the board allocated just over 6 million to continue to support like the trainings and open network and the social impact pilot program, for example. So just gives you a little bit of perspective of other things that's happening. So I'm sorry, I went way over my time.
Thank you, Dawn, and thank you, Nicole. I think you were just a little teeny bit over. I think so. So you're all good, and I think this was extremely informative, and appreciate having these slides afterwards, and really appreciate your responsiveness to our community's input, and really putting our feedback into action. So thank you so much for being here with us.
Thank you all. Have a great rest of your day.
You too. All right, everybody else stay on because we have a couple of announcements. Nicole, I'm going to jump in first to acknowledge a special award that one of our members received. So all of you know Beth Harrington. She's here with us right now. Beth just received an award called the Deborah Newman Cornell Tradition Community Recognition Award. So this is what they said in the announcement about the award. Beth is a Caroline resident who has dedicated decades of service to her community as a nurse, EMT, paramedic, and firefighter. Now 80 years old, Beth has served as president of the Slaterville Volunteer Fire Company for the past 30 years. So wanted to give a round of applause to Beth. And you may have caught that there's an article about Beth in the Cornell Chronicle. I'm going to post it again here in the chat. So proud to be working with you, Beth. Are you here? Is she here? Did we lose her?
I think she was, but she's not anymore.
I didn't see my screen. I didn't see she disappeared. Well, we will have to let her know that we recognized her today. And if you interact with Beth again in the next few weeks, please congratulate her. And then we have an announcement from Nicole and one from Karen, and then we will adjourn.
Thank you, Lara. She was here in the beginning when we did acknowledge a little bit. We just didn't go into detail. So. Thank you, Lara. So I just want to let everyone know the plan for HPC meetings these next 2 months. In March, we're going to have a hybrid meeting, likely at the health department, just need to confirm location, where Sam Hilson and her team will be presenting, the draft that was submitted to New York State and, try to get feedback on how Health Planning Council is going to contribute to the Community Health Improvement Plan. So this is really important meeting to come and really weigh in on what HPC directly can be a part of in these coming years. And then in April, we're going to have an in-person only meeting where we're actually bringing in a consultant who's going to facilitate this conversation in greater detail. Like, what does this look like when HPC is taking on some of these priorities of the Community Health Improvement Plan? Well, I'll leave it at that and pass it over to Karen Brown.
Hi there. I just wanted to update folks that we had our long-term care committee and that we're splitting into work groups. And we have a falls prevention work group that has 7 folks who were there. And then we've changed the terminology from discharge planning to be more inclusive to discharge and transitional processes. And so we have 9 people who are working on that, but we're still open to looking for work group folks who would like to work on those initiatives. They're looking over what the priorities are. And one quick thing, and then I'll move on, but we're pretty excited that Office of the Aging connected us with SUNY Upstate with their trauma injury prevention folks who have a grant and have data related to falls and injuries and is really willing to help us with data, as well as we connected with another organization in Onondaga that has some great potential for collaboration and some collaboration opportunities potentially with Cortland County as well. So that's exciting, and Nicole and I will work on also probably bringing some type of training type stuff related to those 2 topics in the spring.
Awesome. Thank you, Karen. Questions for Nicole or Karen? All right. I see, Sam, you added to the chat. Do you want to talk about the new website? And I'm going to also post the Tompkins weekly article about Chai Tompkins.
Thanks, Lara. Hi, everyone. Yeah, this is our website that takes you to available downloads of the community health assessment. It's broken into sections, so you can just download part of it because the full document is quite long. And then we're continuing to break down this report and have more available online. So we'll be pulling out some of the data so that you can look at it right on the website instead of having to download the report. So that's in progress, but it definitely gives you a good overview, and you can read the executive summary as well. And then, like Lara said, we'll continue to be working on developing the improvement plan or the work plan over the next couple months. So we will circle back to that. Thanks.
Thank you, Sam. Questions, comments for Sam? I think we probably have time for maybe 1 or 2 more announcements. So opening it up to everyone. Cindy, you look like you're looking for the unmute button.
I was looking up how to raise my hand. You're so perceptive, Lara. Thank you. I just wanted to give a quick update on our community SNAP working group. They are working very diligently to come up with and design and implement a community response to the recent SNAP changes that you all got. Adele presented on last month, I believe. So increased, expanded populations that are now subject to work or education or volunteer requirements. So we have a community working group that is very diverse and multidisciplinary, including 3 subgroups, a workforce training education group, an outreach eligibility group, and a volunteer group. And we have created we haven't created yet, but we are on Thursday kind of trying to finalize an outreach plan. So how we can kind of paint the county with education and outreach around connecting people to opportunities so that they can continue to maintain their SNAP benefits. So we're doing outreach plans for SNAP beneficiaries, for providers around exemptions, for educating folks on opportunities and connecting them to volunteer opportunities. We have a web platform that we're going to be launching. And we are very excited about it, and they're working very, very hard. Brittany Earle, the DSS commissioner, is the chair of the group. HSC, along with FoodNet and well, I think that's it, are co-facilitating that group. And yeah, so if you have any questions, you will be receiving directly information around. We're not quite ready to launch that link yet, but we are going to be looking for organizations to post opportunities that you have around volunteering. We're also going to help you kind of equip your organization with preparing your organization to work with folks that are new to volunteer opportunities, perhaps. Soon you will be seeing that link, and I really will strongly encourage you to think about posting those volunteer opportunities, because there's no point in launching a platform when there's no volunteer opportunities available. So yeah, that is all.
Thank you, Cindy.
Yeah.
We will stay tuned for that email. All right. So also just want to acknowledge that there's a few new folks in the room with us today. Tom, Grace, Allison, Ted, you're often here, but not always. So thanks for being here and glad you came. I think we probably need to adjourn. So I'll just share that the next meeting is on March 9th. And it will be a hybrid meeting, and stay tuned for the location for that meeting. All right. Nice to see you all. Enjoy the sunshine.
Fun.
Take care.